My name is William Herzog. I'm one of the cardiology doctors here at UNC Health Southeastern. My background is that I attended college and medical school at Duke, and I did my residency at Duke. I trained in cardiology and interventional cardiology in Washington, D.C., and I was on the faculty at University of Maryland for about 10 years. And I eventually made my way back to North Carolina, and I've been working here in Lumberton and living in Lumberton for the past 3 years. When I was finishing medical school and while I was doing my internal medicine training, I couldn't help but notice that there were so many new therapies in the treatment of heart disease, and it was a very exciting time. We were just learning how to do angioplasty for patients coming in with heart attacks, and you could see really dramatic improvements in the treatment for heart disease, and I just wanted to be part of that. My philosophy of care is that whatever the problem is that we're facing in cardiology, I think about what kind of choices I would make for myself or for a member of my family, and then I use that to guide my recommendations to patients. You have to recognize that everyone has their own set of circumstances, and patients will choose what they wish to choose, but I give them recommendations and try to guide them the best way I can. Well, one of the nice things about cardiology is that we get to see patients over a long period of time. For example, we may meet a patient for the first time when they come to the hospital with chest pain or with a heart attack or heart failure. We'll get to know them then, but then beyond that, we'll follow them as an outpatient in the clinic, and that can go on for many years. And as you see these patients come in, sometimes 2, 3, 4 times a year over a span of years, you really get to know them. You get to develop a connection between yourself as the physician and the patient. And of course, it's our duty as physicians to try to improve the health of patients, and they appreciate that. And we do develop a familial kind of relationship over time. Heart disease, heart problems affect patients in several ways, and it depends to some extent on the stage of life that they happen to be in. Typical manifestations of heart disease include symptoms like chronic chest pain and sometimes shortness of breath. And these symptoms can limit one's ability to do various activities that you'd like to do. If you're in the prime of life and you're working, it can certainly potentially limit your ability to do the kind of work that you want to do. Otherwise, other things that can happen, it can limit your ability to perform activities with your family, whether it's playing with your children or visiting family, traveling. So those are the things that can happen. And as I mentioned before, there are a lot of excellent treatments in cardiology now, so we can often return people to full functionality, and it's great to be a part of that.